Hello, my name is Changsoo from Yonsei University, and today I would like to talk about our ongoing projects on adverse effect of air pollution and the evaluation of the intervention effect among elementary school students in Korea. In this study, we selected atopy, asthma, and ADHD as target diseases. As you may know, atopy and asthma are well known to be associated with air pollution. However, air pollution is considered as a strong risk factor of psychiatric disorders as well, especially during childhood. In Korea, prevalence of ADHD was estimated to be 5 to 9% among children. So our study focused on the effects of air pollution on allergic diseases and psychiatric disorders. In Korea, recently there are some issues associated with air pollution, especially among elementary school. Many parents want to use air purifier in classes and want to know air pollution concentration even in real time. So many elementary school uses air purifier in their classes. However, there are few evidence of air purifier use in elementary school and its protective effects on children's health. So in this study, we will evaluate the adverse health effects of air pollution on allergic disease and ADHD and the effects of the use of air purification system and behavioral modification. Adverse health effects and the intervention effects will be estimated using panel data, which will be followed up to 5 years. First 3 years of this study will be focused on association study, and first and fifth year of this study, we will conduct intervention trial. In this study, we will recruit first and second grade students from at least 4 elementary schools, 2 from Seoul and 2 from Jeonju City, a southern part of Korea. Students will be followed up annually until 2015. Because we are focused on allergic diseases and psychiatric disorders, we will include clinical measurements and screening tools associated with target diseases. In addition, we will also collect urine, blood, and DNA samples. More specifically, to measure children's health, ISAP diet psychological development tools will be included, and for clinical examinations, spirometry data, spirometry such as FENO, Metacolin challenge test will be conducted. As you may know, exposure assessment is the most important issue in environmental epidemiology or intervention trial. So in addition to fixed air pollution monitoring, we will conduct individual monitoring using household and daily activity survey data. We will select 5 or more clusters which have a similar indoor and outdoor environment. Each clusters, 5 or more students will be selected, and the environmental exposure monitoring using exposure tracking devices which provide a more accurate estimate on the air pollution concentration will be conducted. However, due to the weight of exposure tracking device, researchers of our study will use and manipulate the exposure tracking device. However, all students participated in this study will use a portable GPS and the small individual monitoring device. Measurement will be conducted during a week, at least 4 times a year, which reflects the seasonal variation in Korea. For Accurate exposure monitoring places where students stay, such as academic library, stationery store, and game room will be monitored. Using fixed monitoring data, individual monitoring data, and indoor monitoring data, we can estimate cumulative exposure on air pollutants. During first and fifth year of our study, there will be an intervention trial using air purification system and behavioral modification. For behavioral modification, we will develop school air application app, which provides information on air pollution concentration, cumulative exposure estimates, and recommended behavior to their parents and students. Before and after intervention period, we will also collect clinical and epidemiological data, and this data will be compared to estimate the effect of intervention. Using intervention effect and national health insurance data, we can estimate the burden of target diseases and the effectiveness of intervention measurement. Now, I briefly introduce our study result. However, this study was amid pandemic era. Individual survey data might not be insufficient, so I skip this data and I can only show air pollution monitoring data of recruited elementary school. Personal exposure assessment equipment, which we call PM backpack, is about to measure real-time PM10 and PM2.5. All data is transmitted in real time to the DB server using LTE module, and the user is also able to check the real-time data on the website. Until now, we measured the two elementary schools, one in Seoul and the other in Jeonju City, a southern part of Korea. Environmental monitoring in the Seoul was the pretest for establishing study design. Main environmental monitoring was conducted in Jeonju City and measured in February, March, and July. Using monitoring data, we observed the association between PM concentration and the class schedule, the influence of a student's occupancy and load side. This figure shows the association between PM concentration and class schedule. We found the elevation of PM10 concentration during class and break time. However, there was no difference among class schedule in PM2.5 and PM10. From this result, we get the point that the student's behavior is one of the major risk factors increasing PM10 concentration. This figure shows PM concentration in classroom with or without students. Interestingly, PM10 concentration in classroom when students existed was high compared to classroom with no students. However, reverse association was found in PM2.5 and PM1.0 concentration. Although this result might be caused by sampling time, we should further check this result. This figure, we measured 5 microenvironments in school, first and second classroom, and the first and second floor hallway and cafeteria by using PM monitoring backpack equipment. Cafeteria showed the highest concentration in PM2.5 and PM10, and classroom was the lowest showed lowest concentration. But when you calculate the external exposure dose of PM adjusting exposure factors, classroom is the most important influential microenvironment in school for external dose. Because of long class schedule, cafeteria was the lowest because of short lunch time. Our next step is to observe intensive exposure in each student with considering behavior intensity and extension of microenvironment. We also check the roadside effects because this elementary school is located in three-side roadway. Interestingly, third floor showed the highest level of PM2.5 concentration compared to bus station. PM2.5 in third floor was high, except for third floor. The indoors were about to lower than outdoors. Nitrogen dioxide and black carbon are pollutants, which indicate the influence from the road side. In both pollutants, we found that the indoor concentration was lower than outdoors. We found the mass difference of PM, NO2, and black carbon between indoors and outdoors. However, the proportion of constituents in PM from roadside might be different between compared to indoor sources. In summary, we conducted online surveys, and our result shows that during class hour, PM10 concentration was significantly high compared to background situation, and PM2.5 was not associated with class hour in elementary school. And also, the influence of roadside was prominent in high flow area, but not in low flow area. Further study is required for major roads where students walk to analyze the influence of roadside. Thank you for your attention.